Good morning, friends. Good morning. Only last evening, I got a call from a friend who said, I've got a blocked nose. I've got a sore throat. I'm quite sure I have COVID. And she went on to take the RT-PCR test and she was COVID negative. But what I'm emphasizing over here is that there is a tremendous fear psychosis as regards COVID, and it all starts with the E.N.T, the ear, nose, and throat. We all pick up vague signs of a sore throat or a stuffy nose or a mild fever, and we all think that we have COVID. So, in order to clarify your doubts, in order to understand the relationship between the ear, nose, throat, and COVID, and to understand the implication of the eye, we have our webinar today. And our webinar today is post-COVID E.N.T eye disorders and their management. Now we have three speakers. We have two medical professionals. One will talk about the E.N.T aspect and the other the eye aspect. And we have an outstanding naturopathic physician who will be talking to us about the preventive measures that we can take to enhance our health and protect our eyes and ear, nose, and throat. Of course, there's much more that can be prevented through naturopathy, but in this specific instance, we have requested information regarding the eye and E.N.T. When we come to, I'm now going to talk specifically about E.N.T for a second. 68% of individuals who have COVID, from my reading of an Italian journal yesterday, 68% would have a cough, and 50%, and this is the unique distinction between the flu and perhaps COVID, but Dr. Kiran will tell us more about this, have a loss of smell and taste. And you also have the earache. And of course, transmissibility is highest with coughing and sneezing through droplet infection. But enough of my introduction to a subject in which I know precious little. To do this and talk about COVID and the ear, nose, and throat, we have a specialist with 17 years of experience. Ladies and gentlemen, allow me to introduce you to Dr. Rashmi Kiran Fernandez. Now, Dr. Rashmi earned her MBBS and an MS in E.N.T from India. I've already mentioned that she has 17 years of experience, of surgical experience in the field of E.N.T. She is a specialist in a word that I cannot pronounce, but I will do the best I can, a specialist in otolaryngology, if I've got that right. But I would simply say that she is a specialist in ear, nose, and throat. Her expertise is in, she specializes in surgical management of various E.N.T ailments, adenoids, tonsils, septum anomalies, emergency E.N.T care, which includes nasal bone fracture. Now, I noticed that she worked in the NMC, which is a large chain of hospitals, perhaps the largest in the UAE, and she had the great privilege of being the E.N.T specialist to the royal family. A unique aspect of Dr. Rashmi is that she is, I don't know what the word is, but she speaks 6 languages: English, Arabic, Konkani, Hindi, Kannada, and Urdu. In this instance, Dr. Rashmi, I'd request you to speak to us in English. So here we have, friends, Dr. Rashmi talking about ENT related problems with COVID and post-COVID.
Thank you very much, sir. Good morning, everyone. It's indeed an honor for me to be introduced by you, Professor Kennedy. And I might say I speak Tulu as well. So that's 7 languages in all.
Oh, well done, well done. But stay with English, Virat. In this one,
yes.
Stay with English.
Yes, this one's strictly in English for you.
Thank you.
Thank you, sir. So it's my honor and pleasure to be part of this COVID Beat webinar series. The topic being post-COVID ENT eye disorders and its management. So if I may share my screen. The world has been grappling with this COVID-19 virus since the last 16 months, and it still looks like we are in the midst of it, fighting this invisible enemy. Hopefully with an end in sight soon. The whole world is praying for the same. So coming to the introduction, the SARS-CoV virus, what is it exactly? It's a novel coronavirus, SARS-CoV-2, which is the 7th member of the Coronaviridae family, a positive sense RNA virus. The infection in humans was first detected in a wet seafood market in Wuhan, in Hubei province of China in December 2019. In fact, sorry to say, the first doctor who succumbed in Wuhan was an otorhinolaryngologist. Till now, more than 195 million people have been infected with this virus, and the number is still climbing. Unfortunately, around 4.2 million people have also lost their lives. So it is very important for us to understand the modes of transmission of the virus to prevent spread and help in management of the same. According to the Center for Disease Control and Prevention, that's the CDC, the latest update says that COVID-19 is spread via 3 modes, that is the inhalation, deposition, and touch. So inhalation of respiratory particles, which could be divided further into droplets and aerosols. The droplets are usually more than 5 micrometer in diameter and usually spread within a distance of less than 1 meter. That's the highest spread. Aerosol spread, that's the airborne as we call it, is usually seen in hospital setups where we are engaging in aerosol generating procedures, like for example endotracheal intubations, extubations, tracheostomies, dental procedures, suctioning, endoscopies, upper GI endoscopies, sinus surgeries, chest surgeries. So this is very important to know to prevent transmission and spread among healthcare workers. Usually the particles are less than 5 micrometers and spread at a further distance. The droplets can also deposit on exposed mucous membranes as well as surfaces from which it can be contaminated by touch and spread in humans. So coming to the manifestations, just as any other respiratory virus, COVID-19 also manifests as primarily respiratory symptoms, being upper and lower respiratory. So what are the common symptoms that we have encountered so far? Fever is one of the most common symptoms that's usually noted in people, with a range between 34 to 96.5% of patients suffering from fever as a primary symptom. Cough, as Dr. Kennedy mentioned already, is also a very, very common symptom, affecting up to 83% of patients with COVID-19. Other symptoms include fatigue, which is affecting 10 to 31% of patients, expectoration or sputum production, dyspnea, which can range up till 49%. The E.N.T manifestations vary from sore throat. Sore throat is one of the common manifestations. We see a lot of patients coming to us with fear of being affected with COVID, with having sore throats, which may be viral or bacterial or allergic in origin otherwise. But we need to really rule out COVID as one of the etiologies for the same. Nasal congestion, nose blocks, rhinorrhea can also affect up to 72% of patients. Headaches in about 3.5 to 69% of patients, and olfactory dysfunction, that is anosmia, that is the loss of the sense of smell, along with partial loss of taste also can affect up to 100% of patients. This is very, very important to understand. And the ear manifestations could be vertigo, dizziness, tinnitus, earaches. Less studied, but very important to know. Right. So coming to today's topic, we are talking about long COVID. What is long COVID? Long COVID was, in fact, a patient-created term. A lady in London who had suffered from COVID created a hashtag on Twitter and called it long COVID when she had effects of the illness even after she recovered in May 2020. See, the other terms that have been used are long haul COVID, post-acute COVID-19, long-term effects of COVID, and chronic COVID. So in order to better understand and qualify this illness, the British National Institute for Health and Care Excellence, NICE, has divided COVID into two categories. That is the acute COVID-19, which is the symptomatology and the signs lasting for up to 4 weeks after the onset of illness, and as the long COVID. Long COVID could be divided further into ongoing symptomatic COVID, that is patients suffering from the symptoms and signs from 4 to 12 weeks after the onset of illness, and post-COVID-19 syndrome, which affects patients for more than and longer than 12 weeks of the onset of the disease. Okay, and the types of post-COVID conditions the patients suffer from could be also divided as new or ongoing symptoms. This could affect any patient suffering from COVID, be it mild, moderate, or severe. Patient could persist to continue to feel the symptoms that he has felt during the illness in the recovery period and beyond. And recovery might be delayed also. The second one, which is very important, is coming to the multi-organ effects. As we know, COVID-19 has the propensity to affect, if not all, most of the organs of the body by the autoimmune response, and can affect all the organs of the body and manifest in different ways in the post-COVID. Here we have to mention something called as multi-system inflammatory syndrome, which is most commonly seen in children, where most of the organs undergo an inflammatory autoimmune response to the disease. And the third point is very important because most COVID patients who suffer with severe illness are hospitalized for prolonged periods of time and usually in the ICU setups. So this could be very, very distressing to the patient and the bystanders, the family members, and could manifest as what is called as post-intensive care syndrome, which is PICS, which is a myriad of physical, mental, emotional symptoms that the patient undergoes or goes through in his long recovery period after being in ICU for a long time. Prolonged mechanical ventilation in the form of intubation or tracheostomy could also lead to its own set of problems that come along in the recovery period. And of course, we do not need to forget this, the post-traumatic stress disorder, which is the emotional effect that the disease and its aftermath has on the patient and his family. And this is very, very important for us to know. Sorry. Yeah, and so what are the risk factors for long COVID? Who are the patients who are at most high risk to develop this? It's usually seen in older age groups, and it's directly proportional to the severity of the illness and the length of the ICU stay. The longer the patient stays in the ICU and is on assisted ventilation, he'll have a higher probability of developing long COVID. Patients with abnormal lab results, patients with comorbidities like diabetes mellitus, hypertension, morbid obesity, smokers, alcoholics, patients with chronic renal diseases have also a higher risk of developing long COVID. And what are the other factors? It is also recently studied that patients who manifest with 5 or more symptoms in the initial phase of the illness are more likely to develop post-COVID syndrome, and usually seen in ladies, but I beg to differ. I've seen it in men as well. Right. And coming to the post-COVID E.N.T manifestations. Okay, so it could manifest in the ears, the nose, and the throat. In the nose, it could manifest as olfactory dysfunction, that is the anosmia, parosmia, which I'll be talking about soon, sinusitis, and most important, mucormycosis. The ear effects can be seen as hearing loss, tinnitus, vertigo, earaches. Throat can be affected as sore throats, loss of taste, hoarseness of voice, dysphagia, that's difficulty in swallowing, dyspnea, that is shortness of breath or difficulty in breathing, and the effects of prolonged tracheostomy. I'm sure all of you have heard this quote. It says, you're only here for a short while. Don't hurry, don't worry, and be sure to smell the flowers along the way. This is very, very relevant for today's world, where people are running behind things and the rat race. But COVID has brought us to earth and told us that value the people around you, value your family, your life is more important than all the materialistic things in the world. But imagine if you could not smell those flowers along the way. This is extremely distressing. Anosmia is coming out as one of the most important and very distressing symptoms that affects patients during their illness and as part of post-COVID. Sometimes it is the most early and the only symptom seen in patients with COVID-19. Now, this is very, very important for us to know, because a person who has only loss of sense of smell could be a carrier of the virus and spreading it in society. So it's very important for us to know and understand and recognize and get those patients tested as early as possible. Now, most of the patients of anosmia, 1/5 of them usually recover by 5 weeks, and about 1/10 still persist to have symptoms at the end of 12th week. Along with this, anosmia can be very distressing, but even more distressing is something called as parosmia. Now, what is paraosmia? Paraosmia is a distorted sense of smell in the presence of an olfactory stimulus. That is, a person smells his coffee, but he can smell it as paint thinner or gasoline. And, it could be very, very annoying and distressing to the patient. There is another type of dysosmia that is also called as a phantosmia. What is phantosmia? Phantosmia is olfactory hallucination. The patient smells things that have no olfactory stimulus. There is nothing around him, but he keeps smelling gasoline or burning rubber or sulfur, or sometimes it could be pleasant, which is good, but most of the time it is fetid, it is rotten, it is garbage, which is called as cacosmia. And I have personally encountered a lot of patients in my clinic coming with post-COVID parosmia, and I have seen men cry. I have seen ladies desperate for solutions, for help, and I hope we can do that in the future. Now, what is the pathophysiology of this anosmia, parosmia? So it could be divided as conductive and sensory neural. The conductive is because of the inflammation due to the virus. There is mechanical obstruction and edema around the olfactory cleft. That is where the olfactory neurons, that is the nerves which serve the sense of smell, lay. So because of the swelling around that area, the air molecules and the particles are not able to reach that area, and person cannot smell. This is very commonly seen in common cold, flu. Anybody who has a viral infection has this, experiences this, and can present as loss of sense of smell. This is the second most important point, is the sensory neural, because we know that COVID-19 has a propensity to attack the nerves, the neurons. It inflames the nerves. So usually COVID-19, the virus particle attaches to the AC2 expressing supporting cells, what is called as the sustentacular cells of the olfactory epithelium, and also can affect the neurons directly. This explains the parosmia, that is the altered sense of smell. It's usually due to the unique regenerating capacity of the olfactory neurons. The olfactory nerves are one of the only nerves in the body which have this capacity to regenerate. And sometimes, the regeneration happens and it gets misguided. That is, the axonal regeneration goes and fits into the wrong parts of the brain, And that's why a patient senses smell as different. Flowers smell like garbage, coffee smells like gas. And it denotes a recovery of olfactory function, but patient does need rehabilitation and treatment to recover his sense of smell. The most important rehabilitation for this symptom is through olfactory training. That is, It's a process of recreating appropriate neural pathways and sparking neural regeneration. The technique is patients are instructed to sniff 4 different scents. It could be rose, eucalyptus, lemon, clove, for 15 seconds each scent twice a day for up to 6 months. And each time the person smells the scent, he's asked to focus on the memories of the scent, because the nose knows nostalgia. Of all the senses that the human being has, sense of smell is most highly associated with memory. And so this could trigger and help him regain his sense of smell. Along with olfactory training, of course, we do need medication. So what are the treatments, the medical treatments that we can provide? Patient can use nasal corticosteroid sprays, which are definitely known to reduce the inflammation, edema, and also help regain the sense of smell. So it is noted that 44% of patients improved a lot with combination therapy over 6 months, and 27% alone with olfactory training. The other modalities of treatment could be saline irrigation, omega-3 supplementation, alpha lipoic acids, and there are a lot of investigative treatments that are coming up because this is an ongoing research, ongoing study. So evidence of zinc, vitamin B, vitamin A nasal drops, even though they are irritant to the nose, compounded theophylline nasal sprays, and there is something called as cerebrolysin, which is a neurotropic neuroprotective agent, which has been attempted. It's in the phase 4 trial, and it has been given for patients for over 8 weeks with good results. Now, in the recent few months, the world was alarmed by this new term called black fungus. And everybody was scared and everybody was sharing videos and WhatsApp pictures, and it was distressing. Of course, it is very, very important because it is one of the main COVID mortality causes, and also for patients suffering with post-COVID. What is it? Mucormycosis is a fungal infection. It's an angioinvasive, very rare, but almost fatal fungal infection of the Mucormycetes family. It could affect the nose and PNS in 88.9% of COVID patients. And the rhinoorbital mucormycosis is 56.7%. So who are most at risk? Usually seen in diabetics who are uncontrolled, poorly controlled, patients who have been on prolonged intubation on humidified oxygen, patients with heavy steroid usage. And what are the symptoms of the same? Patients have to be looked out for sudden onset of facial pain, headaches, fresh onset of headaches, facial pain, facial swelling, swelling around the eyes, loss of vision, blackish lesions over the nasal bridge and the turbinates, fever, lethargy, seizures, death. So it's very, very imperative to know to avoid use of excessive steroids and excessive immunomodulating drugs in patients with mild or moderate symptoms. We have to really come to a consensus on that. How do you diagnose this? Usually a biopsy is taken from the site of the lesion. CT, MRI, and MRV could also help in diagnosis. And treatment usually depends on the stage of the disease. So main thing is reversal of the underlying illness. We have to take care of the diabetics. We have to withdraw the steroids and control the hyperglycemia, withhold immunosuppressants in patients requiring them. Primary therapy is by liposomal amphotericin B, which is given for up to 3 weeks, and then the patient can be shifted over to oral antifungals. Definitely, surgical treatment does play a role. It's usually in the form of debridement and removal of affected tissue, sometimes also the orbital, the accentration of the eye. A combination therapy is most usually used, along with adjuvant therapies like hyperbaric oxygen, chelation, interferon, and sodium bicarbonate. What are the year manifestations of post-COVID? Now, this has not been studied as much as the nasal symptoms, but usually seen as hearing loss in about 7.6% of post-COVID patients, tinnitus, which is a distressing, annoying symptom of high-pitched ringing in the ears. In fact, a lot of patients have committed suicide because of post-COVID tinnitus, which is a sad statistic to know. 14.8% of patients suffer from that. Vertigo, which is dizziness, can also affect about 7.2%. and earaches. Various pathophysiologies or reasons have been outlined for the same. It could be, as I said earlier, the viral cochleitis or the neuritis because of the COVID-19 propensity for nerves of the inner ear. It could be an antibody antigen reaction to inner ear antigens. It could be because of cochlear ischemia or hypoxia, that is lack of blood supply, or because of drugs that are used in the treatment of COVID. For example, indiscriminate use of azithromycin or hydroxychloroquine could also lead to ototoxicity, that can lead to hearing loss or vertigo or tinnitus. And of course, the stress and anxiety can aggravate the same. What is the treatment and rehabilitation we can offer for such patients? Hearing loss, of course, the patient will have to undergo audiometry and know exactly what's the status. Sudden sensory neural hearing loss is a known entity, and the treatment for which is high dose corticosteroids starting at 60 milligrams per day, tapering off over a period of 2 weeks. We have to be really careful while using corticosteroids, weigh the pros and cons of using the same. Excuse me. Hearing aids could also help such patients regain their sense of hearing. Tinnitus, there's a lot of study done on tinnitus. So it could be helped with what is called as sound enrichment therapy. That is trying to mask the sound of the tinnitus by using white noise machines, music, soft music, podcasts, and there are a lot of apps available in the in cyberspace now to help overcome this distressing symptom. Cognitive behavioral therapy definitely does help. Psychological counseling is very, very important. Tinnitus retraining therapy is usually done by trained professionals who counsel and use sounds to make patients habituate to their tinnitus. It's like living with this disease. Mindfulness and stress reduction strategies do help. There are medications that we can offer for tinnitus patients and tinnitus masking. For dizziness, depends on the etiology. If you are diagnosing it as a benign positional paroxysmal vertigo, then definitely a repositioning maneuver like Epley's maneuver will help the patient regain a sense of balance, along with vestibular sedatives and vestibular rehabilitation therapy, with teaching the patient different exercises in order to retrain the brain and help process signals and compensate for the balance. The throat manifestations. Patients can present with sore throat after COVID because of persistence of symptoms. Symptoms during his COVID could persist in post-COVID as sore throat, post-nasal drip. There could be an added effect of the GERD, that is the reflux disease, which can manifest as pain and irritation in his throat, constant need for hawking, clearing his throat, dryness. Also could be because of prolonged ventilation, prolonged mechanical ventilation, use of endotracheal tubes could cause chronic allergic pharyngitis. Loss of taste is also very, very important, along with anosmia has been mostly associated with it. It's also because of the viral damage of the gustatory receptors. Partial loss is seen in 43%, total loss is seen in about 57%. But the good news is that usually patients do recover within a month and a half. Up to 80% of patients do recover their sense of taste. Okay, coming to another important symptom and sign, that is shortness of breath. Most post-COVID patients do suffer from decreased lung capacity because of pulmonary fibrosis. The lung does not regain its function back to normal. But is that the only reason for the dyspnea or the shortness of breath? No. The E.N.T part does contribute to the same. There is something, there's an entity called as paradoxical vocal fold movement, which is due to the vagus inflammation of the vagus nerve. So the vocal cords do not move as they should during respiration and phonation, presenting as hoarseness of voice and difficulty in breathing. What is the treatment for the same? Patients have to undergo respiratory retraining with physiotherapists and adapt to a low acid diet along with PPIs. There is an important entity that we as E.N.T surgeons may need to face in the future, which is known as laryngotracheal stenosis. What is it? It is a narrowing of the laryngotracheal system, and which can manifest as shortness of breath, stridor, difficulty in breathing, because of the fact that most of the patients are undergoing mechanical ventilation, are in ICU setups, are on ventilators and intubated and on tracheostomies for prolonged periods of time. So this is one of the, I think, complications that we could face in the near future. So what is the treatment and avoidance of the same? We have to definitely select appropriate ET tubes, avoid prolonged intubation, avoid high tracheostomies, administer humidified oxygen, and proper ICU monitoring needs to be done. Treatment of GERD, as stated earlier, use of inhalational steroids, and surgical therapy will be the last option, endoscopic and open. Coming to my last slide, this is the one of the very important points that we need to learn about, tracheostomy in COVID-19 patients, because we are encountering a lot of patients in the ICU setups who have been on ventilators for a long time, requiring mechanical ventilation, requiring air to be sent to their lungs via the endotracheal tubes. And so when do you decide, when do you turn that endotracheal intubation into a tracheostomy? Is it safe to do so earlier? Is it safe to do so later? Usually a patient on a mechanical ventilator on endotracheal intubation is converted into a tracheostomy within the first 7 days, to improve prognosis. But all these tenets have changed during COVID-19 times. We do need to think about how safe is it to do, how is it worth it to do this procedure in a patient whose prognosis may not be good. He may not be able to tolerate it. Maybe his general condition is not going to help him to recover. So, and also very, very important is it is an aerosol generating procedure. So the risk to the healthcare workers who are dealing with these patients in the ICU setup will need to be taken into consideration. So it's a multidisciplinary team approach involving all the members of the team treating the patient. Usually, we have come to a consensus that a tracheostomy may need to be postponed between 10 to 14 days after intubation. We do need to think about the other pros and cons, weigh the pros and cons before coming to a decision on whether the tracheostomy is going to help this patient come out of ICU earlier or not. Definitely, and the decannulation process is another very complicated process whereby the tracheostomy tube is closed and patient is helped to breathe by himself. It's very prolonged, it's very complicated, it depends on a lot of factors. For example, the clinical stability of the patient. Is he breathing on his own? Is he able to cough? Does he have a good cough reflex? Is he able to swallow his secretions? Does he have a good cough reflex? Secretion management, patency of the airway, all these things need to be taken into consideration. And after discussion, and it's a multidisciplinary team approach, as I said earlier, we need to come to a consensus on decannulation of patients. This is very, very relevant to us as E.N.T surgeons and ICU intensivists. These are my references for my presentation today. I hope I have not bored you guys. Looking forward to this time when we will all throw our masks in the air and breathe normally once again. And as RAK Hospital says, we shall overcome, definitely. Thank you, everyone.
And thank you, Dr. Rashmi. Thank you.
Sir. Thank you, sir.
It is so difficult to compress a large amount of information into a short period of time.
Yes, sir.
And you did that remarkably well.
Thank you, sir.
Extremely informative. Thank you so much. Thank you so much. Dr. Archana Sood and Dr. Archana will be talking about the eye, COVID-related eye disorders. Now, I know Dr. Archana personally, we had offices side by side, and I, of course, took advantage by having my eyes checked from time to time, and I'd like to thank her for that. Now, Dr. Archana graduated from the Indira Gandhi Medical College with a gold medal in surgery, And then she went on to work with or to study under or to train under some of the world's leading experts in emulsification. Forgive me stuttering on those words. and phemocataract and phthmologic. I'm sorry, that should read as LASIK. And she did this under the world-renowned LASIK surgeon, Dr. Rupal Shah from India, and also Dr. Pavel Strukla from the Czech Republic. Well, Dr. Archana has 24 years of clinical experience and over 15,000 surgeries with lens implantation and several other eye-related situations. She is also an assistant professor of ophthalmology and has taught at the BP Kerala Institute of Health Sciences and has indexed numerous international and national publications. Dr. Archana and I are dear friends. We frequently have lunch together. And now, Dr. Archana, the floor is yours.
Good morning, everyone. Thank you, Professor, for such a kind introduction. And thank you for making me a part of this important webinar. And thank you, Dr. Rashmi, for a very, very comprehensive presentation. You had the hard task of describing both all three, the ear, nose, and throat. And I have the easy task of describing only the eye, but eye is extremely important. And as you know, without visual function, we are nothing. So I'm going to tell you about COVID-related eye diseases and post-COVID care. Okay, so this pandemic, the SARS-CoV-2, I'm not going into the details as Dr. Rashmi has already described how this virus affects all the organs of the eye. It has health implications of unprecedented magnitude. The infection may range from asymptomatic, mild to life-threatening respiratory disease. And it can affect almost every organ of the body, and the eye is also not spared. The viral ribonucleic acid RNA, it has been isolated by eye swabs from the ocular tissues. And it has a role as a route of entry into the body. So you might start with an eye infection and then go on into COVID. Ophthalmic manifestations may be the presenting feature of COVID-19 infection, or they may develop in the acute phase and continue in the subacute and persist even several weeks after recovery. So you might have symptoms even after curing completely from COVID. The keratoconjunctivitis or involvement of the cornea and the conjunctiva has been found to be initial medical presentation in many reports all over the world. Now the prevalence from a very recent report in May 2021, it has been found that 2 to 32% of COVID patients have eye symptoms or manifestations. So how does the COVID affect the eye? The mode of infection by the virus is either by direct viral inoculation, spread by nose from the nasolacrimal duct, and hematogenous spread. As you know, the E.N.T, the ear, nose, throat are involved. And if you have an E.N.T infection, it is very easy to go into the eye from a pipe which connects the eye to the nose. The viral attack on ocular tissues, it causes uncontrolled immune response, that is antigen-antibody reaction, and a cytokine storm. This affects the eye too because it causes inflammation, swelling, and redness of the eye, which manifests as conjunctivitis or red eye or pink eye in common language. There is vasculitis, that is infection and swelling of the blood vessels, and a hyperclotting state because when the blood vessels swell up, they are narrow in diameter and the blood becomes more, it starts clotting more than normal. So all these clots, they damage the blood vessels in the retina. And this also causes ischemia of the nerves and ocular tissues. And the virus has neuroaffinity, it is neurotropic. So this is the cause of the nerve disorders in the eye. So these are patients from my clinic. The conjunctival hemorrhage or the red spots on the eye, I have seen they have persisted even after COVID in many patients. Then follicular conjunctivitis or redness, swelling of the eye or chemosis of the conjunctiva. Now, how does it happen? It happens due to direct effect of the virus or the immune mediated tissue damage, that is the late presentation, activation of the coagulation cascade, that is the clotting or increased clotting will cause these hemorrhages and prothrombotic state induced by the viral infection. Then there are associated comorbidities like diabetes, hypertension, cardiac disease, patient on steroids, immunosuppressives, they are more prone to these infections. And also the drugs which are used in COVID have been used, especially hydroxychloroquine and steroids, they have caused side effects in the eye. Now, what are the common symptoms which you would have uh, in the course of eye disease with COVID? Dryness, pain, discharge, redness, tearing, foreign body sensation, photophobia, itchiness, blurred vision, burning sensation, lid margin hyperemia, crusted eyelashes. All these symptoms you might have if you are suffering from COVID related eye disease, even after you have recovered from COVID. So, and it also affects the eyelids, the sclera or the cornea. The cornea is the black part of the eye. The sclera is the white part of the eye. It causes meibomitis or swelling of the eye oily glands, the blepharitis or inflammation, hyperemia and telangiectasia, that is redness of the eyelid margins due to dilated blood vessels, episcleritis, that is inflammation of the sclera, inflammation of the cornea, inflammation of both the cornea and conjunctiva, and all this leads to inflammation and spots on the cornea. These are patients from my clinic. If you see, there are fluorescent positive, stain positive spots on the cornea. If they occur in the center, then they cause a blurring of vision. Now, all these conditions are easily treatable if you present to the eye doctor in time by lubricants, supportive treatment, by antibiotics and steroids in some cases, all of them eye drops. Now, the COVID also is the virus penetrates into the eye through the blood during when there is COVID for the patient. So it causes inflammation of the iris tissue, which is called uveitis, abnormalities of the pupil, cranial nerve palsies leading to eye deviations and double vision, orbital cellulitis, sinusitis, that is swelling of the tissues behind the eye, retroorbital pain, dacryoadenitis is swelling of the tear-producing gland, vitritis, that is inflammation of the gel deep inside the eyeball, mucormycosis, as already told, it's a very infamous black fungus, neurogenic ptosis, that is droopy eyelid. Then the very important disease is a CVA stroke, which is associated with the clotting, and then it also causes visual loss and visual field effects. Even there are histiocytic lesions in the orbit leading to a prominent bulging of eye. So the plethora of disease is really vast. Then there are retinochoroidal manifestations also. As I told you, there is vasculitis and there are clots. If the clot reaches a retinal artery, it causes central retinal artery obstruction. And this is a leading cause of blindness for if the patient doesn't present within 6 hours. Central retinal venous occlusion also leading to blindness in a course of 2 to 3 days if the patient doesn't present in time. And you should note that all these complications are occurring because it is occurring in the delayed phase. It is more common in sick patients who have, even after recovery, they might get these problems. And it is common in patients with comorbidities like diabetes, hypertension, cardiac disease on various drugs, steroids, and immunosuppressives. Retinal hemorrhages can occur, that is leaking of the blood from the damaged blood vessels into the retina, leaking of fat, that is retinal exudates, ischemic spots, papillophlebitis, optic neuritis, and papilledema. These are problems with the optic nerve, and they are also potentially vision threatening. So there are some pictures wanted to show you about the mucormycosis, which is a black fungus It affects the eye, and even sometimes the eye has to be removed uh, uh, by orbital exentration to save the life of the patient. It occurs in patients with uncontrolled diabetes, along with steroids and high blood sugar. They are already immunocompromised and they have been given oxygen. So all this creates a milieu interior for the black fungus to grow. And now even a white fungus is coming, which luckily the eye reports are not there. Dacryodinitis, swelling of the lacrimal gland. If you see in the lateral corner, there is swelling. Sixth nerve palsy, the patient looking on the right, he will have double vision and he will later develop a squint. So if there is double vision, if there is blurring of vision, it should not be neglected even post-COVID. You should report directly to the doctor. And all these conditions, they are treatable if you report early. Vasculitis, retinal vein occlusion. This is a picture of deep inside the eye. If you see in the center, there are nerves. Some blood vessels are normal and some have bled. This causes, it is potentially blinding because of the edema in the macular area, but it is treatable. Combined central retinal artery occlusion and vein occlusion. These patients have presented after 2 to 6 weeks of recovering from COVID. So it is extremely important that they present as soon as they start having problems like floaters, flashes, diminution of vision, field effects, or loss of vision. Bilateral atypical optic neuritis, that is swelling of the optic disc along with loss of vision. Neuroretinopathy, again, exudates and hemorrhages in the retina. Papillophlebitis, optic nerve swelling. So if you see the timeline in the acute, before COVID, acute and subacute phase, there are simple problems like follicular conjunctivitis, keratoconjunctivitis, episcleritis. Most of the diseases will occur in the acute phase, in which the patient will be under care of the doctor. But there are some conditions, like I told you, the retinal conditions, they can occur at any phase, even up till the delayed phase, and it is for the patient to present to the doctor as soon as he feels any problem. Now, how will you take care of your eye during and post-COVID? Mandatory consultation and follow-up with the eye specialist, regular treatment with topical eye drops and orals as prescribed by the doctor, maintain proper hand and ocular hygiene, warm or cold compresses, whatever is advised by your doctor. Avoid digital eye strain, because digital eye strain will cause dryness, blepharitis, swelling of the eyelids. You will rub your eyes more and cause more problems. Keep the eyes lubricated. Buy eye drops prescribed by the doctor. Do not wear contact lenses while ill with the COVID or post-COVID, at least up till 4 weeks. Avoid eye cosmetics. Change the sheets, pillows, and towels regularly. Wear sunglasses or glasses for protection, along with proper face mask to prevent the fogging of eyeglasses. The more serious manifestations, which I have talked about earlier, they require detailed advanced investigations and treatment, like optical coherence tomography, retinal, fluorescent angiography, and injections. Even the intravenous immunoglobulins have saved the sight of the patient in retinal diseases, and anti-VEGF, that is anti-vascular endothelial growth factor, injections are given and they save the sight of the patient suffering from venous occlusions and edema of the macula, and sometimes surgery is possible. CRAO, the central retinal artery occlusion, is the only catastrophic vision, potentially blinding disease, and the patient has to present in 6 hours so that the sight can be saved. Now, this is for all population, general eye precautions. You have to protect your eyes. This is a highly contagious virus, and it may be transmitted through the aerosols into your eye from the atmosphere. So at least wear glasses or shades when you go out to get groceries, and keep them on even in the evening and inside the shops. And if you have a pink eye along with at least 2 of the following symptoms of dry cough, fever, shortness of breath, headache, dizziness, or have history of exposure or travel, you have to report to the emergency. Avoid unnecessary routine or follow-up visits to the eye hospitals. And do not talk or speak while the doctor examines you on the slit lamp. And do not remove your mask even on the slit lamp. So to conclude, the coronavirus global pandemic, it has had far-reaching and lasting consequences. The permanent sequelae to different organs, including the eye, and the multitude of presentations, the theories of pathogenesis are still being investigated and unraveled. Most of the ocular manifestations, the good news is that they have a good prognosis if detected early, as there are effective treatment modalities for almost all the COVID eye ailments. And the patient role is to be alert of the eye symptoms and report early. So these are the references for my talk. Stay safe. Thank you.
The good news is that we have you to take good care of our eyes. Thank you so much for that. I didn't realize it was so complex. Thank you so much. Thank you so much.
Welcome, doctor.
And now we have a different type of presentation. I have our third speaker today, and that is Dr. Bhargav. Now, Dr. Bhargav is a naturopathic physician. He was with us in the Apollo hospitals, and he was responsible for integrating alternative therapies with our medical therapies in the Apollo hospitals group. Now, he has completed a 5-year course of study, a postgraduate course of study in naturopathic medicine, and then went on to do his management studies. He also organized, as I recall, he also organized the Harvard series of lifestyle medicine seminars in India that spanned over 4 or 5 different cities. He also spent 3 or 4 years in the United States working there. He also has a postgraduate diploma in lifestyle and wellness management. As far as his working career is concerned, he spent time with the Apollo Hospitals Group. He went on to work as a wellness director in the United States for several years. And most recently, he was the vice president of MediSystems EduTech Private Limited. As I mentioned, he was instrumental in the first postgraduate program of integrated medicine in India, which he did several years back, and was also instrumental on behalf of the Apollo Hospitals Group for setting up a naturopathic and Ayurvedic Ayush wellness resort under the auspices of the Apollo Hospitals Group. I have the great honor of co-authoring 2 books with Dr. Bhargav. Now, Wellness Facilities Management book, that's the book he wrote about his experiences while setting up the wellness resort in Panvel, as I recall, in Mumbai. And the second, a fabulous book on holistic health solutions, 650 pages of great information. Ladies and gentlemen, I present to you Dr. Bhargav Bodu.
Thank you very much, sir. Thank you very much for your kind introduction. Good afternoon to all. Am I audible, sir?
Yes, Dr. Bhargav, you are audible and we can see you very clearly.
Thank you, sir. Thank you so much. I'm going to share my screen. So today, I'm going to speak about the natural treatments for post-COVID E.N.T. and eye problems. Dr. Rashmi ma'am and Dr. Archana ma'am has beautifully explained the various technical aspects of post-COVID E.N.T. and eye problems and how to manage them. But I'm speaking only from the preventive aspect, how natural treatments can be used to prevent these complications. And whatever I'm going to speak today has been tested and used by many patients in Tamil Nadu. In Tamil Nadu, the government of Tamil Nadu has included naturopathy as a part of public health strategy in treating corona patients. They've included naturopathy treatment in all the government hospitals where the corona patients were taking treatment. And they have found out that when combining naturopathy with modern medicine, they were able to prevent most of the long COVID or post-COVID symptoms or complications. As we all know, the corona pandemic, the COVID pandemic, has caused a lot of misery in the world. Many patients, even after recovering from corona, they're still suffering with long COVID symptoms. So some of the treatments, what we can do at home to prevent these symptoms or complications, I'm going to explain now. As Dr. Reshma ma'am has already explained the various E.N.T problems, the most common symptoms or complaints what we're seeing is sore throat, nasal congestion, nasal obstruction, ear pain, and smell affections and upper respiratory tract infections. And there are many cases of black fungus affecting these patients in India. Many patients have been affected with mucormycosis. So it is always advisable if somebody complains of any E.N.T problem after corona or after COVID infection or after recovery from COVID infection, it is better to consult an E.N.T specialist and get a correct, timely diagnosis and treatment. These are some of the simple natural treatments which has been used by Tamil Nadu government in treating the corona patients. They've included these 3 treatments in their treatment protocol along with the modern medicine. The first treatment is applying coconut oil or cow ghee, few drops of coconut oil or cow ghee in both the nostrils. And some patient has any infection or severe cold, you can mix few drops of tea tree oil in coconut oil and install those drops in the nostrils. And patient has to take this for 5 minutes after the treatment. And after 5 minutes, they can blow their nose. So the oil and any mucus secretions will be expelled. And after the coconut oil treatment, the patient has to take steam inhalation. As we all know, steam inhalation is an ancient household remedy for treating common cold and cough. Our ancestors and our grandmas has used this always in our homes. So you can add a few half teaspoons of turmeric, or maybe eucalyptus oil, or even camphor, or even fresh mint leaves. Turmeric is a powerful antiviral medicine. It also is an anti-inflammatory. Take steam inhalation at least for 5 to 10 minutes. And when you inhale the steams, inhale very slowly and very deeply. Do it for 5 to 10 minutes. After the steam inhalation, wash your face, and you can gargle with hot turmeric water or hot salt water. And if you don't have access to salt water or turmeric water, you can use a simple mouthwash for gargling. All these treatments, 3 treatments combined, will prevent most of the E.N.T problems. And patients can do them both at morning and evening. And some patients have even done for 2 to 3 times a day, 3 to 4 times a day, and they found out that they were able to prevent most of the E.N.T problems. Now, apart from the natural treatments, we have to also follow a certain diet to prevent all these E.N.T problems. As we all know, foods which are rich in vitamin C, zinc, and vitamin A, they improve the immunity. And patients have to eat all these vitamin-rich foods. For example, vitamin C is rich in oranges, guava. Zinc is rich in legumes and seeds and nuts. Vitamin A in carrots and tomato. And when we eat the fruits, it is better to eat the fruits directly instead of drinking the fruit juice. And it is always advisable to avoid any commercially prepared fruit juices, because the commercially prepared fruit juices contain very high amount of fructose and sugar, which is not good for the body immunity. And protein is very, very important for these patients because when recovering from any infection or from any disease, body requires a lot of protein to rebuild the tissues. So high protein foods like nuts, sprouts, legumes, all this should be consumed. Generally advise vegetarian protein because it's always easy for the body for digestion. And probiotic foods, they also should take probiotic foods like yogurt, kefir, miso. We all know that the microflora or the gut microbiome is very, very important for body immunity. Most of the body immunities depend on the healthy gut microbiome. The probiotic foods improve the health of the gut microbiome. So everybody should include all this, even not only COVID patients, even healthy people can also get benefited by including the probiotic foods in the daily diet. And when it comes to water, the COVID patients, they should only drink hot water or warm water. 10 to 12 glasses of warm water is necessary for body dehydration. And they should avoid drinking ice cold water or cold water because it can irritate the throat. And virus normally harbors in ice cold water. And there are certain nutritional supplements which are very good for E.N.T health. We have already discussed about vitamin C rich foods. The same way vitamin C supplements, there are many vitamin C supplements in the market, but the best form of supplement is liposomal vitamin C, because the liposomal vitamin C increases the absorption of vitamin C in the blood. Whereas the normal vitamin C powder, which is available in any chewable tablets, doesn't increase the absorption in the blood. And other supplements like zinc, vitamin B complex, selenium, they're all very good for health. Now let us come to vitamin D. Now vitamin D is very, very important for body immunity. Our ancestors, they used to work very hard, under sunlight, outdoors. So they never had vitamin D deficiency. They actually were having high levels of vitamin D in their body. But all of us nowadays, we work indoors, we don't expose our body to sunlight. So many of us suffer from vitamin D deficiency. And studies have shown that people who have got less vitamin D in their bodies were prone for many complications of COVID. And people who had a good levels of vitamin D, they were able to, they didn't have any major complications. So vitamin D is very, very essential. When you start taking vitamin D, please start with 60,000 international units daily for 5 days. And after that, you can take 1,000 to 2,000 international units every day. If you can't take every day, you can take once a month, 60,000 international units. Vitamin D is a fat-soluble vitamin. It is stored in the body. So if you take once in a month, that's enough. But vitamin B and vitamin C, they're water-soluble. They're not stored in the body. So you have to take them every day. So some of may think that, we're eating healthy food. What is the need? The present day cultivation, the present day chemical fertilizers, doesn't result in a good vitamin levels in the foods. So sometimes we have to take supplements. Flaxseed oil. Flaxseed oil is rich source of omega-3 fatty acids. Omega-3 fatty acids have anti-inflammatory properties. They're very good for immunity, heart health, and brain health. You can take flaxseed oil, or you can eat flax seeds or walnuts. And if you eat animal foods, you can take salmon, mackerel, tuna. All these foods contain high levels of omega-3 fatty acids. There are certain herbs for E.N.T problems. All of us, normally, particularly Indians, are Asians. They use ginger, turmeric, garlic, onion, black pepper in their foods. They use it for cooking. These herbs have got a very good, they're very good for respiratory health. This may be one of the reasons that, the Indians or maybe the Asians were able to, have less complications of COVID when compared to Westerners. Westerners, they don't use much of these herbs. But, Indians and Asians, they use these herbs in their diet. So please include these herbs in your food, in your cooking. And other herbs like ashwagandha, astragalus, echinacea, ginseng, reishi mushrooms, these herbs are good for immunity. They regenerate the body and they improve the strength of the body. I'm going to suggest a simple herbal tea. Even Indian government has suggested the same herbal tea to be used by everybody during the corona pandemic. And most of the people have started using it. So all these herbs, they're available at your home. You need not buy from outside shops. So take 2 grams of ginger, black pepper, basil leaves, clove, cinnamon, mint. Put them in 200 ml of water. Boil the water for a few minutes until the water becomes 100 ml. Filter the water. You can add 1 teaspoon of honey and maybe a little lemon juice in that. Drink the tea at least 1 or 2 times a day. This will improve your throat health. It is very good for throat and nasal problems. And the second drink, which is called golden milk, and Ayurveda has given a lot of importance to golden milk for throat problems. It's called as golden milk because the milk looks like gold. Take almond milk. You can add 2 grams of turmeric, black pepper, and cardamom. As we discussed now, turmeric and black pepper have got very good antiviral and anti-inflammatory properties. Almond milk is advisable instead of cow milk and buffalo milk, because many people have got allergy to cow milk and buffalo milk. But if you're not allergic, you can use them. But generally, cow milk increases the mucus production, so we don't advise. We advise plant milks. So boil the milk until it becomes, until the 200 ml of milk becomes 150 ml. You can add a teaspoon of honey and a few strands of saffron. Saffron is also very good for throat health. And drink the milk before going to bed. You can drink 1 or 2 times. You can give to children. It's very good immunity enhancing milk. I'm going to suggest a few pranayamas or breathing exercise. Simple exercise for E.N.T health. This can be done by anybody, anytime. So the first exercise is called Kapalabhati pranayama. So Kapalabhati means cleaning the skull. So this pranayama actually expels any unnecessary or stored mucosal secretions from the upper respiratory tract. So it involves breathing slowly, normally, but breathing out very quickly and forcefully. The second pranayama is called Brahmari pranayama. So this is, Brahmari means humming bee. So in this pranayama, we have to breathe in very slowly, normally, but while exhaling, you should produce a humming sound, slow humming sound. Now, Brahmari pranayama, a lot of studies has been done by Brahmari pranayama because it has been shown to increase the production of nitric oxide in the nasal cavity and the sinuses. And the nitric oxide has been shown to improve the nasal tract health, and it also has got antiviral properties. And there are some companies are even try to produce nitric oxide sprays, nasal sprays for COVID treatment. And you can do a simple Brahmari pranayama to do that. I'm going to quickly demonstrate these 2 pranayamas just in a few minutes. You can see that. So the first pranayama is Kapalabhati pranayama. Take a slow deep breath and exhale very quickly and forcefully. So this is called Kapalabhati. Do it at least 20 to 30 times in a minute and do it for 5 minutes, morning and evening. The second is Brahmari pranayama. This involves covering your ears, covering your eyes with fingertips, and take a slow deep breath and exhale with a humming breath. So cover your ears, cover your eyes, nose, take a slow deep breath and exhale with a humming sound. The humming sound, while doing the humming sound, please feel the vibration in your head and also in the body. The humming vibrations dislodge the mucus. It increases the ciliary movement and also production of nitric oxide. Now let us discuss a little bit about the eye problem. Dr. Archana Madam has beautifully explained about various eye problems and what to do, to treat them. So the most common eye problems is pink eye, the conjunctivitis, eye pain, irritation, redness, swelling of eyes, sensitive to light. And as she said, some people may also suffer from retinal vascular problems, occlusion of retinal artery by thrombus. And some people may also have problems with optic nerve, resulting in neurological and ophthalmic problems. So it's always better to consult an ophthalmologist if you have any of these eye problems for a timely diagnosis and timely treatment, because any delay can cause loss of eye, because even the fungal infections also can cause problems with the vision, and sometimes they have to remove even an eye. I'm going to suggest a few simple natural medicines to prevent these problems, but if you suffer from any severe eye disease, please consult your ophthalmologist. The first treatment is rest your eyes every 1 hour. If you're doing any work, please get up from your chair, wash your eyes, wash your face. So it gives rest your eyes. There is a rule called 20-20-20. It actually means every 20 minutes, shift your vision on something which is 20 feet distant from your place, and focus on that distant place for 20 seconds. So this gives rest to the eyes. If you have any eye swelling, you can apply cold compress, because the cold reduces the eye swelling. But if you have any redness, there is no swelling. If you have only pain, you can apply a warm compress, or you can apply a tea bag, green tea bag or a warm tea bag. Dry eyes can cause a lot of pain. So use artificial tears or you can do blinking. And if the air in the room is very dry, please use a humidifier to moisten the air so that you will not suffer from dry eyes. And vitamin A rich foods, particularly carrots and other things, are good for eye health. And there are certain herbs like gotukola, amla, ashwagandha. They are very good for eye health. You can use these supplements after consulting a physician. There are certain simple eye exercises which can be done by everybody except the people who have got a retinal disease or glaucoma. These are very simple. Just move your eyes up and down, left and right, diagonally, clockwise and anti-clockwise. And after doing these eye exercises for a few times, rub your both the palms until you feel warm and apply the palms on your closed eyes for a few seconds. This relaxes the eyes and reduces the eye strain. And now I'm going to discuss a few general precautions which has to be followed by everybody, including including normal people or people who are recovering from COVID. The first most important thing is maintain a social distance, stay at home if you're sick, wash your hands frequently, use a sanitizer even whenever you touch an object. The simple precaution of washing hands frequently can prevent many, many infections. And use a face mask and cover your eyes with goggles or maybe glasses. And avoid close contact with anybody who is sick. Avoid touching your mouth, nose, and eyes. Stay at home if you're sick. And if you're coughing or sneezing, please use a tissue. This is my last slide. The COVID pandemic has shown that people who have got a very good immunity, who have a good health, were able to were not affected by COVID in any way. They didn't have any major symptoms. They had a very mild symptoms, sometimes no symptoms at all. But people who had immunity problems, they suffered a lot, developed major complications. And one of the important things to have a good health is to follow a natural, healthy lifestyle. And I'm happy to inform you that Professor Kennedy sir has formulated these 6 rules of good health. And under his, under his guidance, we have conducted many seminars on rules of good health for various corporate companies, and they were benefited by that. So the first important rule is eat a natural, healthy food. The food what you eat should be natural in the form. Raw salads, sprouts, raw foods, fruits, all this should be taken in more quantity than the cooked or modified food. Please avoid any outside food or processed foods. Second is exercise at least 30 minutes daily. So by means of exercise, you need not go to a gym and lift heavy weights. You can do a simple exercise at home, walking, jogging, cycling, swimming, yoga, calisthenics. All this you can do at home to improve your general health. Sleep, 7 to 9 hours of quality sleep is very essential, because during the sleep, the growth hormone will be very high, which helps in rebuilding, recovering. The body repairs itself during the sleep. So the sleep is necessary, particularly for people who are recovering from COVID. Avoid smoking. Smoking is #1 killer. And people who have COVID, definitely they should avoid smoking. Reduce stress at your workplace, at your home, and practice meditation and relaxation. And the last important rule of good health is get a health check done. If you buy a vehicle, you get it serviced every year. You go for a checkup of the vehicle. The same way, please get a health check done. Then you will know what is your condition of the body. You will know if you have any risk of developing any disease like maybe diabetes or a heart disease or a cancer. All of us know that even cancer, if diagnosed early, can be cured. Thank you, friends. Thank you, sir. Thank you so much for giving me an opportunity to speak in this webinar. Thank you, sir.
And thank you, Dr. Bhargav. Thank you so much. Thank you so much. What you said was so simple and so beneficial to large populations that can be kept healthy by these simple rules that you have so well propounded. But what makes them valuable is when they come from the lips of learned individuals like you. These are simple things that all of us do or try to do or should do on a day-to-day basis, but we gain confidence when it comes from a knowledgeable and experienced individual like you. Thank you so much, Dr. Bhargav.
Thank you very much for your kind words. Thank you very much.
Thank you. And Now we have my senior colleague, Dr. Wilku, who is the prime mover of this entire webinar series, who will compile or has put together or has compiled some of the questions for our faculty. Dr. Wilku, sir, to you.
Thank you so much. It was a wonderful presentation by all the faculties. Dr. Rashmi has given very wonderful information on E.N.T. Dr. Archana has given for eyes, and Dr. Bhargav has given for holistic health. We received many queries earlier also till yesterday evening. We received many questions, but I'm picking up few questions right now because many questions have already been answered by the faculties. Uh, there is one question from Mr. Harsahej. He says one of his relative has history of asthma and allergic cough. He has recurrent episodes of dry cough after COVID. Is it due to COVID? And what should be done? I think Dr. Rashmi, you can answer this.
So I hope he is doing better now.
Yeah.
Usually COVID-19 does cause more morbidity in patients suffering from asthma and other chronic pulmonary diseases. So the patient in question right now could be suffering from post-COVID, or it could just be an aggravation of his asthmatic symptoms. What I would suggest for him is definitely to continue with his anti-asthma medication, stick to his asthma action plan, avoid allergens, take good care of his health, as Dr. Bhargava just said, try to improve his immunity by using all the herbal supplements and improve his lifestyle. From the E.N.T. point of view, his dry cough could also be just a manifestation of the sore throat, as I said, the post-nasal drip and the reflux, which could be manifesting as a dry irritant cough. So for that, definitely steam inhalation, saline gargles, betadine gargles, reduction of oily, spicy, sour foods in his diet, maybe adding a PPI or an antacid to his prescription, and local care of the throat with rehydration, humidification should definitely help in his cough.
Yeah, thank you, ma'am. There are 2-3 questions which are similar, so I will club all of them together in one question.
Yeah.
One person, gentleman has asked, he is 38 years old and has a history of hypertension.
Okay.
My eyes become very watery and itchy. And in the chat box also, Miss Viji has also asked similar question. Post-COVID, I could feel dryness in my both eyes. What should we do? Dr. Archana, you can answer this.
Yeah, thank you for the question. And it is extremely relevant in general in the COVID times, because people have been indulging in digital eye strain a lot. And as Professor Bhargav said, that they have to limit their digital eye strain by decreasing their screen time and following the 20-20-20 rule. Now, the dryness which persists after COVID, it may be due to 3 reasons. Actually, the tear film layer is made up of 3 components, that is the lipid, aqueous, and mucin. The lipid layer is made by the tear glands, the meibomian glands, which are present in the eyelid. As I told in the presentation that the eyelids are inflamed, the meibomian glands are inflamed during COVID due to the general inflammation by the virus. Now, they will stop secreting the oil properly, and that is causing dryness, because the first layer of the tear film is the lipid layer, and if the lipid layer is not proper, it will evaporate all the tears in your eye. Now, the second layer is the aqueous layer, which is secreted by the lacrimal gland, and there are glands in the eye also. If the aqueous layer is not proper, then again there is a problem. All these glands, the lacrimal gland, as I told, they are inflamed in COVID. So this is causing dryness to the participant who has asked the question. So the treatment for this is that they have to use the lubricants for a long time after COVID. Lubricants, artificial eye drops have to be used. It's better to show to a doctor first, get it prescribed. Preservative-free lubricants are available in small ampules, and they can be discarded after single use or a single day use. And I would recommend that every 2 hours initially for the first month, lubricant should be added in the normal life, to prevent the dryness. And sometimes the watering is also due to the inflammation caused by the dryness, that is called reflex epiphora. That is it is a reflex irritation, and the lacrimal gland waters more, but the actual root cause is the dryness. So even the watering and even the itching, dry eye is associated with inflammation. Inflammation causes itching. So all these symptoms are all related to the dryness, which is post-COVID. In post-COVID cases, it's due to inflammation.
Yeah. Thank you, ma'am. There is one wonderful question every time it's coming again and again. One gentleman has asked, after COVID nowadays, most of the time I feel nasal blockage and feel less sense of smell. So please advise. Dr. Rashmi, you have already clearly mentioned about the things, but
Yeah.
please answer this again.
Yeah, sure. Thank you for the question. Yeah, as mentioned earlier, right, nasal congestion and loss of sense of smell or reduced sense of smell are common manifestations during the illness as well as post in the recovery period. This is common to all kind of viruses. In fact, if you suffer from a common cold or a flu, these are all those similar kind of manifestations that we come across, but more so in COVID-19, because as I said, it has more propensity to affect the nerves. It's a neurotropic agent, as Dr. Archana earlier said. So as I mentioned earlier, the pathophysiology is because of the mechanical obstruction. That is because of the edema, the swelling, the inflammation that happens due to the illness, as well as the involvement of the supporting cells and the olfactory neurons. The good news is that, of course, there is a recovery. It may be delayed, but definitely there is a treatment for the same. As I mentioned earlier, patient could be put on nasal steroid sprays, saline irrigation, use of antihistamines, and as Dr. Bhargava rightly mentioned, there is a great role for steam inhalation, installation of natural drops into the nose, saline gargles, improvement of lifestyle, improvement of immunity, adapting a better lifestyle, breathing exercises that he mentioned. Definitely all these play a big role in rehabilitation of a patient suffering with post-COVID nose block and loss of sense of smell. Yeah.
Thank you, ma'am. There is one interesting question because I have come across personally also with my patient. During COVID, I had a blood spot on my right eye. I took treatment, now it is less, but still present. Is it serious? Dr. Archana, it's your...
A blood spot on the eye would be usually it is a conjunctival hemorrhage. And as I said, because of the clotting disorders during COVID and viral infections of the eye in general, they will cause small blood vessels on the eye, on the white part of the eye, to bleed. And the blood, because it's a blood clot, it will persist for some time and it should disappear. In around at least 2 to 3 weeks, it should completely disappear. So if it's not disappearing, it is better if eye consultation should be taken. And usually it is not a very serious disorder, and it should disappear by treatment with topical steroids, antibiotics, and lubricants.
Thank you, ma'am. I think Dr. Bhargav has given so beautifully in a simple measures, preventive measures. So everyone is already having the good knowledge. But for my understanding, Dr. Bhargav, can you give simple 3 tips we should be following in a general health and during management of any disease? 3 simple tips.
Yeah, I suggest eating a very healthy diet and following all the sanitary or hygiene precautions and taking enough rest. These 3 are very, very essential in any particular disease.
Okay. Thank you, Dr. Bhargav.
Thank you,
Professor
sir.
Kennedy, over to you, sir.
It is my privilege to give a vote of thanks. I would like to thank our faculty Dr. Rashmi, Dr. Archana, and Dr. Bhargav. Those were very, very informative talks, very knowledgeable, and we are the better for having sat through these talks. What I'm especially delighted with today is the wonderful integration between our three faculty. The comfortable acceptance of modern medicine in its allopathic traditions to naturopathy and its ancient traditions. Our modern specialists in allopathy did refer to several of the advice given by Dr. Bhargav as being helpful. And that is a very comfortable acceptance of an integration of a multidisciplinary approach and perspective. I'm truly delighted with this approach by my three faculty today. I would like to thank Dr. Wilku. Now, Dr. Wilku in this session merely asked the questions, but what you don't know is that Dr. Wilku actually puts together this entire webinar. He decides the topic, he sits with our medical director and selects the speakers. He makes sure that these systems are all in place. And he is ably supported by the rest of the Arabian Wellness team, Sadeh and Saloni and Mr. Shrikant and our IT team, which includes Libin. So I'm certainly grateful to my team for the support over there also. And you can best perform with an audience. And our audience has been grateful, we are grateful for our audience's presence. They have loyally sustained and stayed with us over the last several webinars. And we've even counted more than 100 participants, which is very, very rewarding to us. Now, when it comes to the next webinar, and here again is an interesting thought. When it comes to our next webinar, we have so many options that sometimes we cannot decide exactly which webinar will come next until almost the last minute. So in our mind, we have thought about obesity management post-COVID, because obesity is a factor that is a causative factor. In fact, it's a risk factor for the COVID aspect. We are talking about the cardiac association with COVID. Now, that could be an interesting topic, and there are several others. But I will end today, friends, with thanking my faculty, thanking our support systems and Dr. Wilku, and thanking our audience. We look forward to seeing you 2 weeks from now. But until then, in case you would like to see a recording of whatever we have spoken to, the valuable advice given by our faculty, it is on our website. And not only is today's recording on our, not only will today's recording be on our website, but also the several others, the 9 other webinars of valuable information. Just log on to our website. It's right there at the bottom, www.rachospitalrehab.com. And thanks to Dr. Archana, I can actually read this from the distance in which I am sitting. So thank you very much, ladies and gentlemen, and good day.